There's one study that was presented in ASCO in 2016, which was a subgroup. It was a subgroup analysis or a subgroup of the MAINTAIN trial, which looked at bendamustine rituximab induction followed by maintenance versus observation. And that was not published. It's not published yet as a paper. In that trial, there was no benefit in PFS or OS. Those are patients that didn't get transplanted and were not fit for transplant and received the most common induction regimen we use, which was not really reflected in this meta-analysis. So I think a lot of clinicians in practice don't offer maintenance rituximab in the setting of no transplant. So you do chemoimmunotherapy, you get a response, and then it's sort of unknown. A lot of it is unknown because this abstract doesn't show a benefit. So I think that's a place you could explore it further, whether it's changing the induction regimen, even if you don't go to transplant, could a more intensive chemoimmunotherapy regimen be more useful and pertain some sort of benefit in terms of PFS at least in this setting. I think using cytarabine induction in patients who are younger would also be probably one of those populations where maybe a maintenance rituximab method would be helpful. It would be nice to see the paper published, but I think for now there is more consensus on offering rituximab maintenance for patients after transplant, and a little bit of still controversy without transplant.